of Health will leave Joburg to KZN, Mpumalanga, and then return to Johannesburg. 9 free diabetes screening and testing stations will be available along the route. And Mr. Tom Molokoane, Head of Market Access at Novo Nordisk, now joins us here in studio to tell us more. Tom, a very good morning to you. Thank you so much for joining us today.
Yes, good morning to you and your listeners.
Thank you so much, Tom. Now, you've just come back from riding 1,200 kilometers around the country for diabetes. Tell us all about this great initiative, sir.
Oh, thank you very much for the question. In fact, there's an initiative of Novo Nordisk in conjunction with Dr. van Staden, who is hailing from George. It's supported by the Department of Health and the provincial and local authorities, municipal authorities. And the real intention really is to raise awareness about diabetes. Mm-hmm. As you may be aware that World Diabetes Day is the 14th of November. Yes. And there are a lot of initiatives and activities, not only in South Africa, but around the world, to actually mobilize the communities in raising their awareness. Mm-hmm. So this initiative has got 4 years. We're running into 4 years now. As we speak, my colleagues, other cyclists, are actually arriving now. Wow. In Mary Fitzgerald.
Okay.
It started 4 years ago. And then we started this year in Alexandra, where we offered free screening and testing for the community, as well as Dobsonville. So our first stop over when we started on Thursday was Heidelberg. And then we moved through to Newcastle, Pietermaritzburg. And all these towns, as we go through, we're actually offering diabetes education. Mm. So it's a noble initiative, basically, of trying to raise awareness about this diabetes, which is a major challenge in South Africa.
Please do tell us why diabetes is such a major challenge in South Africa.
It is a major challenge. Just to put it into perspective, last year, in 2014, there's an estimation of 415 million people living with diabetes in the world. And the estimation is that in 2030, which is not very far from now, there will be about 600 million people living with this diabetes. And the bulk of those people will be coming from developing countries, low and middle income countries. And therefore South Africa is part of those. A crude estimate of the prevalence of diabetes in South Africa is about 2.7 million. That is last year's estimates, but now we have to wait and see what the estimates are going to be when IDF releases the new numbers. Mm-hmm. But we're thinking that it will probably be around the 4 million, which is a major problem. So not only does it put a lot of pressure on the individuals and society as well, it puts a lot of pressure on our healthcare system. Hence, the Department of Health has prioritized this as a big initiative.
Absolutely. I mean, we have to do everything we can to try and combat the disease. But now, Tom, tell us more. What is diabetes? How do people even know that they have it? What are some of the most common, symptoms?
Yeah. So thanks for that question. Diabetes is, I think in layman's term, it's the body's inability to produce insulin and to use that insulin. We actually need insulin all the time to take care of glucose in our bodies, to take glucose into our cells. Yes. As you know, that glucose is a source of energy. So in layman's terms, that's diabetes. Some of the common symptoms associated with diabetes is blurred vision. You tend to have thirst. People that get that thirsty, they get tired. And as I say, sometimes you deprive your cells of glucose, so you're going to feel hungry. So hunger, is one of the symptoms of this disease, and so those are early signs of diabetes. Yeah.
Now, Tom, where can you go to test, and is there no stigma associated with diabetes in South Africa?
No. You can test everywhere. You can test with your healthcare professionals. I mean, our clinics offer testing. Our hospitals offer testing. So I think
so you don't need to go to a specialized center, basically?
No, not at all. Not at all. It's quite important, I think, for people to know their status, because the earlier it gets identified, the easier it is to manage it.
Look, Tom, you know why I was asking you if there's no stigma attached to diabetes is because it is often perceived that diabetes is a condition for the aged, but now the younger people are being diagnosed lately. Yeah. So that's what we're working with here.
Yes, it may be so in the past. I mean, especially in particular type 2 diabetes patients tend to be associated was associated with older people. But the current president of IDF, who is actually a pediatric endocrinologist, has said that he has seen an increase in the number of younger people being diagnosed with diabetes. If you look back in, say, in the 1992, there was about 16% incidence of type 2 diabetes in the younger people, and when he moved to moved to 1999, the number had increased. The incidence to about 33%. So it's getting more and more, but I mean it manifests itself in the same way, as a combination of the difficulty in producing insulin and of course the body using that insulin. So it's not a disease or a condition of the older people only, more and more of the younger people.
Tom, what would you say causes diabetes? Is there any specific thing or maybe behavior that is associated with people that tend to suffer from diabetes?
Yeah, there are some risk factors, associated with diabetes. One of them is obviously choosing your parents.
Hereditary.
Hereditary, yeah, there's some, if your parents have had diabetes.
Unfortunate, yeah.
Yeah, exactly. There's a good chance that you'll have it as well. A sedentary lifestyle contributes to that. Immunization, which we know that is happening at a great rate.
Fast foods.
Exactly, fast food, what we eat, you're right, what we eat, inactivity. We know that...
we drive everywhere.
Exactly,
we take the lift everywhere.
Hence, part of this initiative of riding around the country is actually to try and encourage people to do some exercises. And one doesn't have to ride a bicycle to exercise. There are all kinds of things that you can do. You can run, you can walk, you can do basic things just to get into some activity.
Tom, now besides raising awareness for diabetes, this event also aims to raise awareness for disadvantaged children that are living with diabetes. How does that program work?
Yes, exactly. That's actually the crux of this initiative. This is, as I said, is the brainchild of Dr. van Staden in collaboration with Novo Nordisk, which started, as I said, 4 or 5 years ago. And the whole mission is to try and raise funds to support, in particular, disadvantaged children to access the modern treatments of diabetes. So it's ideally, as I said, it's to raise funds to support, in particular, the disadvantaged children.
Wow.
So how it works, it goes around, as I say, this is the highlight of it because it's Diabetes Month, but throughout the year there are campaigns to raise awareness and actually to raise funds for this cause. So if there are people that are willing to contribute, we do have a number.
Please go ahead and give us all the information there, Tom.
And the number to contribute your support for this initiative is Cities Changing Diabetes, Cycling for Diabetes. And the account is at Nedbank. Branch code is 109 11 400. I'll repeat, 109 11 400. And the account number is 107 17 68 557. 107 17 68 557.
All right, we'll definitely have those details also on our website,
Sure.
Tom. But now, before I let you go, now you look like you're in your outfit. Now you've only started cycling this year, Tom. Motivated by this event, are you hoping that this event motivates more people to take up cycling? And tell us how well you fared in your cycling.
This actually is a very interesting. We have the what we call the pro teams, a team of 16 that have done the whole leg.
Okay.
And last year, in fact, when we had a similar campaign around this time, this team, we call ourselves the Team B, Novo Nordisk Team B, actually started in the studio with your colleague Leanne. Leanne is, by the way, part of this team.
Awesome, hey?
Manas. And then she asked me for a challenge. Shall we support this initiative? And I said to her, yes, if you run, I will do it. And before I knew, we had started this. And so we are 5 months into this. I'm talking about Team B, Novo Nordisk Team B. And we've had a very good coach who's helping us to go through this. And we actually did part of the first leg with our cyclists. And then this morning, as they were arriving back from Standerton, my colleagues joined them, and they're arriving them with them in Medifis Garrett at the moment. Okay, so your legs are not sore yet, Tom? No. I'm fine, thank you. Tom, this is a great initiative. Yeah. Best of luck with it, and hopefully we'll see it all over the country. Yeah. Thank you so much. Thank you very much. That was Mr. Tom Molokoane, the head of market access.